Hi, this is Marcy White at Copley Acupuncture. I just wanted to talk today about a treatment I absolutely love doing. It's called labor preparation. I do it multiple times a week for my pregnant patients, and in the past we called it labor induction treatment. I feel that the word induction doesn't have a very good connotation, so I prefer to use the word preparation. And what I recommend is that my pregnant patients start coming in for acupuncture on week 37 of their pregnancy. So this is when you're fully term. And at this point, we can start doing some points in acupuncture treatment that are called forbidden points. They're called forbidden when you're pregnant because they can have the ability to disrupt the pregnancy. So there's a set of points, and depending on the practitioner that you see, they'll use probably different points in each treatment, but there are a core set of points that are always used in the labor preparation. Some of the points are named after organs in your body, and if you're not familiar with acupuncture, this may sound a little bit strange. One point is called large intestine 4. Large intestine 4 is on your hand, on the index finger, in between the webbing of that and your thumb. And so basically in acupuncture, we have pathways, or what we call meridians, and each of them is named after an organ. The large intestine meridian runs along the index finger, it goes up the arm and the neck, and it goes into the head and face, and then to the throat and into your large intestine, which is why we name it after that organ. There's also a point called spleen 6, which is on the ankle, and that follows the inside of the ankle, goes up into the pelvic region, and up to your spleen. So this may sound a little bit odd if you've never had a treatment before, but basically what these pathways are, often, most of them are nerve pathways. So when I was in acupuncture school 25 years ago, we were taught that points like large intestine 4 could help stimulate labor. I know it works. I've done it before. I could just never really understand why it did what it did. And now with more time and more research, especially things like functional MRI technology, which is absolutely amazing, where you can see the brain and activity in the brain in real time. While you're doing that, you can do something like stimulate an acupuncture point, and you can see exactly what parts of the brain are stimulated. The large intestine 4 point has the ability to affect contractions and get contractions started, and spleen 6 does that as well. Why that is because this nerve pathway of the large intestine meridian is called the superficial radial nerve. And that superficial radial nerve goes up into the head, into the brain, and it has branches that end at the hypothalamus. And the hypothalamus is an area that communicates with your pituitary gland. So the hypothalamus releases hormones that tell the pituitary what to do. The pituitary can do things like help you release something called TSH, your thyroid stimulating hormone. Also LH and FSH, which go to the ovaries and help with ovulation. So in this case, when we're stimulating it with an acupuncture needle, what's happening is that you're releasing oxytocin, and oxytocin helps start contractions. Another great effect of the large intestine 4 point here on the hand is that it helps you release something called beta endorphins in the hypothalamus, and then those beta endorphins travel to a part of your brain called the periaqueductal gray, and there they bind to their receptor sites. They're like opioid receptor sites called mu opioid receptors, and there it blocks pain, and it helps with mood, and it helps create a sense of calm. So another great thing is that if you're stressed before the impending labor, this can be a wonderful addition to helping you feel more relaxed. Sometimes I've done the labor preparation treatment and someone went into labor soon after, and they found that their labor was a lot less painful and less stressful because they had these circulating opioids in the body, your body's own opioids, the beta endorphins. So these are some of the wonderful effects that can happen. These treatments can also help lower catecholamine levels in the body, which can get very, very high when you're under a lot of stress. So what I have people do is I have them come week 37, week 38, and week 39, and we gently needle those points. And that's all that we do. Then when you get to week 40 and you get to your due date, you can apply something called electroacupuncture. Electroacupuncture really elevates a treatment and makes it much more precise. So what I do here is I put some clips on the needles, and then I put it on the frequency that would get the stimulation to go to the hypothalamus and specifically release beta endorphins. And the way we do that is we do 2 hertz of electricity for that, and we also apply that to the spleen 6 point. Over time, if you're not going into labor within a few days, then we can increase these frequencies a little bit. But you want to go slowly, and you don't want to do it all at once and do a very strong treatment. Most people I find in my practice go into labor within about 48 hours of the first treatment. Sometimes it takes a couple of treatments. I have had some cases where people did not go into labor with the treatment, and it turned out there was something else going on and it needed medical intervention. This is a really great treatment. It is very gentle, it's very safe, has a pretty good track record, and I think it's something definitely worth thinking about. I do like to mention these things because a lot of my pregnant patients just don't know that they have these options, and I'm seeing them when they're week 42 and they haven't come in for any acupuncture, and it's a little bit harder at that point to get the labor started. Not impossible, but prevention is always one of the best things in my opinion. So I really appreciate you watching this video, and if you like this, I would love if you'd subscribe to my channel. I'm going to have a lot more information coming up soon, and if you're interested in me talking about any specific topics, please let me know. Thank you very much.